Astigmatism is a very common eye problem nowadays. It is a refractive error. Before talking about refractive error, we have to know what is refraction in the eye. Refraction is nothing but a deviation of light rays when it passes from one medium to another, both having refractive index. So, while passing the rays, it is a deviation. The light rays reflected from the object is traveling parallel in the air and it reaches the eyeball, and then it starts its passage through the eyeball. During this pathway, it is getting refracted. In the eyeball, there are 4 such media. The external most is cornea. Just behind that, the fluid medium, that is aqueous humor. The third is lens, which is little more jelly in nature, and the fourth is behind that is a semi-fluid gel-like material, it is vitreous humor. And through these 4 media, this light rays is passing and getting refracted in such a way that it is converging or focusing on a particular point on the innermost layer of the eyeball, retina. On the retina itself in a particular point. And this will happen only if all these refraction is working properly and in its own perfect way. If there is any change in the refractive index or in the surface of the refractive media, this is not possible. Then light rays may not be converging on a particular point on retina. This condition is known as astigmatism. It may have sometimes multifoci and getting converged out in front of the retina. Such a condition is known as astigmatism. So, if that is why it is known as a refractive error, since there is some error in its refraction. So, what should be the symptoms? Since the light rays are not converging on the particular point, the steps for sense of vision is not possible, and only if it is converging on that point, the reactions will be starting, and the impulse formation is the result of these series of reactions, that is photochemical, then electrical, then nervous. That type of reactions are going on one after another as a chain, and the end result is the formation of a nerve impulse, and this impulse is carried through the optic nerve to the visual cortex, and in the visual cortex again some changes is happening, and the result is the formation of visual sense, the actual sense of vision. So, if it is the light rays are not focusing on this center, this series of reactions are not possible. So, perfect vision will not be possible. There will be blurring of vision. What are the symptoms? The first symptom will be blurring of vision, and then there will be sometimes some headache. Associated symptoms are sometimes headache or sometimes mild pain or eye pain, especially while focusing on these objects, and then sometimes there will be watering of the eye, and then in rare cases there will be squeezing. The patient will be squeezing his eyes to get the correct picture, and these are the symptoms. Then there are different methods are using now, just like glasses and contact lenses and LASIK treatment. So many methods are there, but according to Ayurvedic theory, the treatment is in different way. It is the focus of the treatment is to bring back the system to normal. Anyway, we have to change this refraction from the abnormal situation to the normal situation. These are all live cells only, either cornea or lens, whatever it may be. It has its own metabolic activities and its physiological actions and all the properties. So, medicine will act upon it. It is possible. So in that way, the treatment is arranged in Ayurveda. Any movement, we have already seen that the movement of light rays from the external object to the retina, that is a conductional light rays, it is a correct movement. This is performed by the factor Vata. So if there is any change in the normal movement, that is due to the vitiation of Vata. And the medium, all the refractive media of the eye, that is fluid or jelly like, etc., these are having the dominance of Kapha factor. So if there is any defect in this medium due to Kapha vitiation, then also refractive error is possible. And the light rays as such is Pitta dominant. So any change in the these light rays in its way or in this from the source like that, then also refractive error is possible according to Ayurvedic theory. So we have to identify what is the actual factor, whether Kapha dominance or Vata dominance. These are mainly two factors. Light rays, it will be normal in most cases, or only if it is from a highly illuminated source, then there will be some problems, and that is different side. So we have to consider mainly Vata and Kapha in the case of this astigmatism. We have to control both and to bring the actions to the normal side. So it is said that if there is any irregularities on the surface of the refractive media, especially of the cornea, that is corneal astigmatism, we will say, and then it is very clear that the refraction will be different, abnormal. The light rays may not be having a uniform path, uniform refraction. So that will result in astigmatism. So we have to make the corneal surface smooth and the curvature in the normalcy. Then only corneal astigmatism can be controlled. Then there will be this type of abnormality in the lens surface also. If the surface is not regular or not, curvature is not in the normal way, then also this astigmatism may develop. Rarely some changes in the refractive index of this aqueous humor or vitreous humor, then also this type of refractive error is possible. So in all these conditions, the only aim of the treatment is to bring the properties and functions of these factors to normal side. For this, we know the accommodation and adaptations of this distance, etc. It's possible by the movements of the eyeball. So the correct way of eyeball movements, we have to practice it in the treatment level. That means there are 6 sets of muscle bundles in the eyeball, extraocular muscles. One is superior, then inferior, lateral, medial, and 2 oblique sets. These are the 6 muscles. So by the movement of these muscles, the eyeball will be deviating this side, that side, like that. And the iris muscle inside the eye will control the amount of this light rays. So we have to make possible to bring these muscle movements to normal sides. For that, normal type of these eyeball movements are to be practiced. And by the movements, practice these movements, the curvature of the eye lens also can be changed. It is made up of fibers, so protein fibers. So it is having the property of elasticity and flexibility. So we can stretch it or contract it by correct movements. So this is one aspect in the treatment. Second is, but it should be remembered that there is some defect in this movement. That is why astigmatism is developing. So we have to make these muscles and nerves strong enough or healthy enough to perform these actions. For that, there are very peculiar, very scientific methods in Ayurveda to make the flexibility and elasticity, etc. of this refractive cells of the refractive media. becoming normal in its function. These are different types of treatment procedures. For that, oil has a very important role. Using oil for different treatment modalities. This is for the Shiro Abhyangam, that is scientific method of massage on head region, and then putting oil on the head, that is known as Talam, then Shirovasti, Shirodhara, like the different procedures are there. And by selecting the apt method for that particular patient, we can achieve this goal. And then second section is, there are so many internal medicines, oral medicines, to give the muscles and nerves and the cells of the ophthalmic tissue strength and health and improving its functional capacity. By using that, we can bring these structures to have its normal properties and normal functions. That also is highly effective. There is another set of treatments which is used in the eye itself, locally, ophthalmic medications. That also is very important in the treatment of astigmatism. The main thing is, one is Tarpanam. Tarpanam is a method in which medicine is filled in the eye for the calculated time, for a particular period. For that that is a very scientific method, and the time calculation also is important, how much time, which medicine, and even the time of application is important, whether it should be done in the morning or in the evening or in the noon time, like that also varies according to the nature of the patient, especially the constitution of the body of that particular patient, because each patient is having his own or her own body constitution and its own peculiarities and the tolerance level, and everything is different from one person to another person. So, in the treatment of any disease in Ayurveda, all these factors are to be considered. That means one medicine which is given to one particular disease in one patient may not be effective for the same disease in another patient. That much variations are seen in different patients. So, that is based on the expertise of the doctor or the handling person. So, that is very important here also, because the group of, mainly it is affecting children. It starts from the early age and it may be long standing up to lifelong in some cases if nothing is done. If there is some irregularity or this anatomical defect, it may be like that itself. Nothing will happen to that patient. So, it can be left untreated also, using some controlling specs or lenses that can be controlled. But in some cases, it will be increasing in its nature, progressive in nature, because there is some pathology behind that, or some thinning of the cornea, or some defect in the flexibility of the lens fibers, etc. Then it will be progressive in nature. That should be controlled, that should be treated. For that group, treatment is absolutely necessary, otherwise headache will be very severe in that group. In that group, we will prefer treatments, and for that treatment we have to consider all these factors. First is body constitution of that patient, second is the eye strain of that particular patient, then the actual cause of a particular disease, whether it is on cornea or in lens or in the fluid system, like that. Sometimes it may be associated with some other disease also, even though it is a structural defect, some other ocular conditions may contribute its role. There we have to consider that causative disease also can be considered during the treatment time. So, first of all, decide what is the actual cause, then what is the physical or the body constitution of that patient, that is dosha prakriti in Ayurveda. Then what is the impact of his eye strain of that particular person. Then comes the medicinal role. Taking all these factors or considering all these factors, the treatment of astigmatism is very successful.